And yeah, go ahead and, yeah. Alright, so if we take a look at the cat, if we locate the liver, then just superior to the liver we can find the diaphragm. So you'll be able to see that muscular diaphragm. That's again going to be superior to the liver. We can also see in the thoracic cavity the lungs, which are going to be on either side of the heart. And the heart is going to be housed in a pericardial sac. So surrounding this heart, take away some of that fat tissue, you can kind of pull up and see that pericardial sac that's going to be surrounding the heart. We can also see the trachea. If we move these vessels aside, you'll be able to see the tracheal rings. And then if we move up further, there we go. You can also see the larynx. Specifically, you'll be able to see and feel that thyroid cartilage. So the larynx is going to be located right here. If we take a look in his mouth, that's obviously going to be the oral cavity. And if we open his mouth, you should be able to see on the hard palate the rugae. So those are those folds. If we look at the tongue, should be able to see the lingual papillae, the little hair-like projections coming up from the tongue. Might be hard to see on the video. We've got the canines, we can see, and the incisors, so we can see those two teeth as well. Let's see. If we take a look posterior to the trachea, you should be able to locate the esophagus, which is this tube that's right here. Again, posterior to the trachea. If we move down into the abdominal cavity, covering the intestines is going to be this apron-like structure, which is the greater omentum. If we pull that away, we can see the small intestines, and if we look between them, we can see the mesentery of the small intestines, prevents them from becoming entangled when they're moving food through. We can also see the large intestine here as well. If we again find the liver, just inferior to the liver is going to be the stomach, so we can see that here. We can also see the gallbladder, this sac-like structure here that's going to store bile. We can see our kidneys. That will be found on either side. And then if we take a look at the kidneys, we can find the ureter. And then this tube will extend all the way down to the urinary bladder, which is right here. If we look at the male reproductive system, we have the testes. We remove the tunica albuginea, and we can see the epididymis. So the testes would produce sperm in the seminiferous tubules. It would move into the epididymis, into the vas deferens, which with the vessels makes up the spermatic cord. So this cord right here leading away is going to be the spermatic cord. And then the penis is located here. So if we take a look at the vessels, we'll start in the thoracic cavity. If we find the aorta, and we look at the arch of the aortic arch, the first two branches are going to be the brachiocephalic artery and then the left subclavian artery. If we follow the brachiocephalic artery, it branches off into the right subclavian, which is here, the right common carotid, and then also the left common carotid. The superior vena cava branches off into the left and right brachiocephalic veins. And then if you follow the brachiocephalic vein, it branches into the jugular veins. And this is the right external jugular vein. If we move down into the abdominopelvic region, if we find the kidney again, we can see the renal vein. And then just next to that is going to be the renal artery. If we follow the inferior vena cava down, we can see that it's going to split into our common iliac, and then we'll have our external iliac and internal iliac. And then if we follow the descending aorta, then we can separate that into two Y structures, and so we would have the external iliac and then the internal iliac as well, arteries. The last artery that we can see on this specimen, so again, if we're following the descending aorta, we have the inferior mesenteric artery, and we can see it feeding the mesentery. Okay. So there's the male. Now we can do the female.